Hello, this is Derek Sachito, and I will give a presentation on principles for providing speech and language pathology services in rural communities of Alaska. Uh, the challenge first is to provide speech pathology services in rural areas. This challenge is nothing new, with difficulties in such areas of traveling long distances to access a community, the costs associated with this travel, and the poor awareness within the community of what speech pathology services entail. Uh, However, issues are magnified when looking at providing care in rural Alaska communities for several reasons. Of these reasons include the difference in cultural considerations for health and communication, a greater need to build trust among local community members, consideration for necessities of families with already complex issues, management of native languages, and implementation of effective speech-language treatment approaches outside of the traditional Western therapeutic model. Cultural considerations for health and communication. These are considerations the SLP must practice when providing effective treatment. Roy 2004 reinforces this idea when he says, effective intervention for Alaska Native children must incorporate the gifts of indigenous ways of learning and knowing. And this learning and knowing is an important point in terms of their acceptance and then practice of any interventions. Cultural considerations did not appear to be limited to just the education and learning, but also with communication. In fact, traditional practices and beliefs differ from Western perspectives in regard to interactions and communication styles, as often exemplified in turn-taking styles in traditional tribes. This said by Faircloth and Pfeffer 2008. I myself have also noticed this as a speech pathologist when working in rural Alaska in the intricacies of communication, such as difference in verbosity, facial affect, tone, voice volume, initiation of language, initiation of communication, and all these things must be acknowledged and embraced in the therapeutic process. A heightened awareness of the effective community, along with an underlying understanding of communication styles, are paramount to be an effective therapist. Necessity of trust. Of course, trust is important in any therapeutic model, not just speech pathology, but even more so for working in rural Alaska for several reasons. Building and maintaining trust is to be a cornerstone in Native Alaska setting when considering the history of indigenous people and changes taking place. So, taking into account what has already happened within this community, both in the distant past and also currently, really warrants the need to be especially sensitive in focusing on building trust. A large and unique component of building trust is reliance on assuring community members that adaptations would be made to the assessment and treatment process to meet the needs of the student that were sensitive to culture. So ensuring to the community that adaptations will be made to assessment and treatment based on the specific needs of that student and the culture, and a already established model from a Western speech institution would not just be implemented, but would be adapted. The SLP must be respectful of cultures, practices, and beliefs to establish and maintain a rapport and sense of trust in the community members, says Faircloth and Pfeffer. They also suggest concrete steps to begin the trust-building process, including facilitating the provision of child care services, food, and transportation. So these little steps, facilitating these small steps, can really go a long way with ensuring community members that the SLP is solely out for the benefit of each student and the family and the community. One way that it seems can really facilitate this is really spending time, not just on a micro scale, but also repeatedly coming back to the community year after year, of course, goes a long way. Necessity of considering complex needs. Providing treatment and giving recommendations requires modifications when considering a hierarchy of needs. So, for example, under typical circumstances in the average white middle class school in the lower 48, a treatment for expressive language may be to name pictures of animals during book reading classroom tasks. Whereas a more appropriate approach in rural Alaska may be to consider the immediate environment of the student, what communication scenario is most encountered on a day-to-day basis, then work towards verbal output or gestures to identify or name objects in the home. So instead of asking a student student and family who already have a number of needs outside of the communication realm to set up specific time to address a certain communication deficit, rather adapting our treatment model as SLPs to implement these objectives within the daily event of the task, within the daily tasks of the student and the family, really to improve the functionality of it, but also the ease of addressing each area. Studies, and this just goes into a little bit of the background that some SLPs might have, especially early in the career and as students, in terms of awareness of other areas, other cultural areas and needs associated with that. And this is reflected in Ebert's work when he states that in order to build cultural competence, there must be a raise in self-awareness in sensitive areas such as racial privilege among speech and language pathologists, especially students and those who are relatively new to the field. And part of the self-awareness process may require opening a dialogue with the families regarding the needs of the student and the family as a whole, while also reflecting on responses without judgment. Management of native language. The language as it is used in the home versus what is used in the school, as well as the unique language acquisition process, are two fundamental factors in providing educational and SLP instruction. Engelbrecht in 2008 described traditional language as highly contextual with an emphasis on physical surrounding and reliance on shared knowledge of the speaker and listener, whereas school-based interaction is low context and reliance on written and spoken words, broken down in chronological sequence. So being aware of these two different styles of learning, not just in the school, but also in terms of learning treatment principles, is important. Highly contextualized versus low context, physical surrounding versus reliance on words. Modifications to acknowledge this difference may include finding content that's appropriate for an Alaska Native student and utilizing that content, and this can be determined through consulting tribal members, family members, etc. Another factor to consider is second language acquisition. What may appear to be a lack of English proficiency may in fact be the child's attempt to communicate in both his or her tribal language as well as English. This is especially important from the perspective of an SLP providing appropriate and ethical intervention. The SLP must take proper steps to ensure language delays are being addressed. This can be done by consulting with family, an effort to understand what language is being used at home, analyzing errors, utilizing formal language assessment, not normed for rural Alaska, and having the presence of an interpreter during treatment and evaluation when warranted. Adaptation of traditional Western treatment model. It is recommended, perhaps, that an entirely different model may be used to effectively, in rural Alaska, to effectively provide treatment due to the significant difference of culture and lifestyle, as well as the functionality of education and communication objectives. Resources for different models are very limited, as most existing interventions are norm-based, says Faircloth and Pfeffer, 2008. However, Denmark and Toner, 2003, did provide 6 concepts as a framework to help the therapist make necessary changes. And these are recognize and incorporate indigenous languages, emphasis on the role of traditional culture in the interactions between adult and children, seek to align traditional culture with contemporary context, include a strong parental and community involvement component, acknowledge and use the social and political values of the community. Another area is home visits. Home visits are an adaptation to the SLP treatment to allow observations of communication and behavior that families and children engage in, which may be used to generalize outside of the home. Another dilemma for rural Alaska service providers is how to give functional and motivating instruction. Needs of Alaskan Natives differ significantly from those in the lower 48. For example, with the frequency of use of such activities, such as subsistence activities, and how this may impact motivation. The use of a multicultural framework is one way to try to adapt or rather increase motivation. This is done by kind of looking at more of a holistic approach that builds on and respects the knowledge students bring from the home. Another area is a core theme, a core theme to this approach is to ensure students gain skills necessary for functioning in a rapidly changing world and connecting to a broader international context. This multiliteracy framework contains 4 components, including situated practice, overt instruction, critical framing, and transformed practice, and those are listed below. Within these 4 is the use of design modes, which are linguistic, audio, visual, and gestural and spatial forms of communication in which the SLP can utilize during a number of receptive and expressive treatment tasks. So in conclusion, a common theme found within this paper and also in other papers has been the disconnect apparent within providers and recipients of treatment. This disconnect in the speech pathology, this disconnect is found in other areas within speech pathology was not immune to it. Faircloth and Pfeffer also add to this by saying the importance of recognizing the impact of tribal communities have on their children is a concept lacking on the educational system in the educational system among SLPs. Without proper understanding of and respect of tribal communities, it will be almost impossible to develop and implement interventions that will be effective long term in these communities. Overall, the general principles for providing effective speech therapy services in Native Alaska must include the mindset of cultural consideration, trust building, awareness of needs, appreciation of Native language, and creativity. With these principles in mind, a true connection may be possible. Thank you so much.